Hello there. I just wanted to go over some of the post-op instructions. If you're watching this, it's most likely because you just had a knee scope with me. And first of all, I want to thank you for entrusting in me to have the ability to get you back to the lifestyle that you want. First thing we wanted to talk about here is the dressing that you'll have on. So a standard dressing after a knee scope procedure looks like this. And what it is an ACE wrap with some fluffy padding underneath. The big one right here is called Navy D, and these here are called 4x4s. So now we'd like you to keep this whole dressing on for 3 days, which means you have to keep it clean and keep it dry. You can shower with that stuff on, but the goal is to keep it clean and dry. So you'll have to cover it with something to make sure you don't get it wet. Once you take it off 3 days later, you'll have these steri strips on here. And these are sticky strips that should stay on until you see me in clinic. Should they tend to fall off or something like that, don't worry, you can leave them off. Once you take this big dressing off and you leave the steri strips on, you can shower with it. It's okay if it gets wet. Just pat that area dry. So now I'd like to go over the activity that you can expect with your knee and what we'd like you to do in order to optimize your outcome. The first thing we'd like to talk about is walking after the surgery. So most of the times after a knee scope, you're going to be able to walk and put full weight bearing on that leg. But a lot of times after knee surgery, your quad gets weak. Sometimes you don't have the support that you necessarily want, especially for the first few days after surgery. That's why we say it's good to use crutches to help give you a little bit more support as you're walking around to make sure you don't fall. So in order to get that quad strong again, we have certain exercises we'd like you to do before you see me back in clinic. The first one is one called a straight leg raise. That's where you keep your leg straight and you lift your foot off the ground and you go up and down. That causes your quad to fire and helps it strengthen and wake back up after the surgery. Another one we like to call is the towel exercise. Really, you get a towel from around the house, you put it underneath your knee, and you try to push your knee all the way down to your bed or your couch or whatever you're utilizing here. And that too makes you fire your quad and try to get that back. Other things that we like are motion. So we use an exercise called heel slides to put your foot up and slowly slide your leg back. Our goal is to get 0 to 90 degrees by the time you see me back in clinic or better. Finally, you can do things like ankle pumps to kind of keep the blood flowing to make sure we aren't at any risk for any blood clots. One final thing we like to talk about is when your leg's at rest. A lot of people, when they have an injured knee or just had surgery, like to put a pillow right underneath their knee because it feels good. Well, that's not great for healing because sometimes you can really tighten up the back part of your knee. So ideally, we'd like to slide that pillow to your foot. That allows you to get a straighter leg and helps your motion with regards to returning back.